Things are so worrisome in DeSoto County. Its Board of Supervisors tonight is asking for a state-run field hospital and testing location to be put there. Both of the county's major hospitals, Methodist and Baptist, are out of ICU beds. In the state capital of Jackson, a field hospital opened just today in the parking garage of the University of Mississippi Medical Center. That hospital is also accepting appointments for a monoclonal antibody infusion clinic for COVID patients. And you can expect to hear a lot more about this treatment. Tonight, one couple explains why they're convinced the infusion kept them out of the ICU and saved their lives. Here's Scott Simmons.
Holly Smith didn't have the vaccine shot before she got COVID-19.
I've had every symptom you could ever imagine. I mean, it's been to no taste, no smell, to vomiting.
Her husband, Glenn, got it too, but he had the vaccine.
Some nasal congestion and some chest congestion. My taste is a little off and no sense of smell, but compared to what she went through, it hasn't been nearly anything like what she went through.
Holly was hospitalized where she received a monoclonal infusion that helped lessen her symptoms.
Can't even imagine going through it again.
Treatment helped her symptoms subside to where she's not in the position where she was before. I've never seen what she's gone through. I wouldn't wish it on anybody.
Doctors are urging patients with a recent COVID-19 diagnosis to seek the monoclonal antibody treatments. Typically, it can have measurable improvements for a patient who gets it within the first 10 days.
And we can give them monoclonal antibodies that are similar to what our bodies make. And we basically are calling in reserves, external reserves, to fight off the infection. And they work wonderfully.
Starting Tuesday, UMMC will take appointments for a MAB infusion treatment at its new makeshift hospital wing in Parking Garage B.
The goal of the monoclonal antibody therapy is to keep patients out of the hospital.
The hope is the infusion of additional antibodies will lessen the demand for hospital beds, and the criteria to get it largely rests on a positive COVID-19 test and other underlying conditions.
Obesity, chronic medical conditions, age, those types of risk factors that we know. These are the patients that have the hardest time overcoming a bad case of COVID-19.